Thungela Resources is committed to improving access to basic healthcare to the communities around their operations. This is Sikhululiwe village, a hamlet east of the Middelburg and close to the Mafube colliery. It is an agricultural village that comprises of about 450 houses and is home to more or less 500,000 inhabitants. Mpendulo Ndimande and Zinhle Nkosi are two healthcare workers based at the nearby newly built clinic. They are paying a visit to Gogo Mina, a local resident of Sikhululiwe. She is hard of hearing and has eyesight problems.
Bathi ubachazela ukuthi lento iqale nini uthole nini ukuthi unenkinga yendlebe and then usizakele kuphi ekliniki. After usizakele ekliniki wafaka ama-eardrum umuphi umehluko obe nawo wena batshele nge-Afrikaans ukhulume nge-Afrikaans.
These house visits have become more and more frequent to the residents of Sikhululiwe. Since the completion of a modern clinic which was built by Thungela Resources in partnership with the Department of Health and was donated to serve the Sikhululiwe village and surrounding farming communities. The donation was made in October 2019.
I'm speaking of something like 20 kilometers. They had to hike to access the next clinic, the next available clinic. And they also had to rely on the provincial mobile clinic, which only comes once in a month. So hence I'm saying Mafube has really intervened in this particular manner of bringing health services to the doorstep of our communities.
An essential infrastructure project that Thungela built and donated to the Mpumalanga government is the TB Hospital of Witbank located in Ackerville. This is a day facility of outpatients mainly, but also includes a 16-bed unit for hospitalization and longer stays. The project was completed in 2019.
The relationship has been long before Thungela demerged from the Anglo-American, and not only to this hospital, but to the whole department. Time to time, Anglo will donate ambulances and also big clinic across the province, and that has been the honor that we've been receiving. And for us to get the state-of-the-art hospital that is 16-bedded, it was really an honor, and we know that through the weights of the board of the Thungela indicated that the business can't survive without government, and vice versa, government can't survive without the business. So that has been really the good contribution in terms of social corporate investment from the Anglo or Thungela to provide service to the community of Mpumalanga. The need for the new building was really long overdue. Looking at the infrastructure of the hospital, it's really very, very old. I think we are now on the 65th year in terms of looking at the back when it was established.
I spent my time here for 2 weeks. It's a great facility. Also, the medication is taking its place, and we're probably recovering from the virus that we have. The staff is great when it comes to the nurses and it comes to the cleaners till up down.
With the state of the art, once they've cleaned, you can see right now someone was here. So it's really putting the morale across the spectrum of all the clinical groups. It's either your doctor, your nurses, your general assistants, even patients as well. So they feel like they're at home. The board, together with the Thungela executives, made a contribution of 1.5. That was to buy the mobile X-ray machine that is in our facility as we are speaking. And they see a need, since we are a TB hospital, it's a chest hospital. Therefore, time to time, there's a need that we need to do the X-ray or looking at the patients in totality. Very few hospitals in South Africa do have such a kind of machine. No, I think the future of the hospital is bright. Now as a department is in process of doing the rationalization across the province. But as a hospital, we are ready for any change that is coming. So we know that TB is one of the leading causes of death in South Africa. So the TB space will always be occupied by these hospitals, and will still continue providing research in conjunction with University of Pretoria. And I think the future is bright for the hospital and for the colleagues to explore.